Hello mga kabady! Welcome to Tito D TV. Once again, this is Tito D. And our tea is all about Miss Universe 2012 who had surgery because of her endometriosis. Do you know what it is? Yes! Miss Universe 2012 Olivia Culpo had a surgery with endometriosis. If you wanna know about it, just stay tuned on Tito D TV. And do not forget to subscribe to my channel, hit like button, comment down below, and click the notification bell so that you will be updated once we have a new video. So what endometriosis all about? Endometriosis is a disease in which the endometrium, this is the tissue that lines the inside of the uterus or womb. It is present outside of the uterus. Endometriosis most commonly occurs in the lower abdomen or pelvis, but it can appear anywhere in the body. Symptoms of endometriosis include lower abdominal pain, pain with menstrual periods, pain with sexual intercourse, and difficulty getting pregnant. On the other hand, some women with endometriosis may not have any symptoms at all. Approximately 10% of reproductive age women have endometriosis. However, the true prevalence is unknown since the diagnosis requires laparoscopy. It is a surgery where a doctor looks in the abdomen with a camera through the belly button to visualize and biopsy endometriosis lesions. Endometriosis is seen in 12 to 32% of women having surgery for pelvic pain and in up to 50% of women having surgery for infertility. So endometriosis is rarely found in girls before they start their period, but it is seen in up to half of young girls and teens with pelvic pain and painful periods. So what is the causes of endometriosis? For that, let's see what Miss Universe Olivia Culpo said about this. Yesterday, I had surgery for my endometriosis. Not a very glamorous post, but I felt like I needed to share this to create more awareness around this disease. Endometriosis is a condition where tissue from the uterine lining decides to grow in other random parts of your body, causing pain. This can interfere with fertility and overall health and honestly, happiness. To top things off, it is excruciatingly painful but nearly impossible to see through an ultrasound. I have been in agony for years around my period and I was misdiagnosed countless times by doctors. Just take Tylenol every day, ultrasounds looks normal. I think you just need to rest more. Periods are always uncomfortable for people, etc. I know a lot of people out there in the endo community are familiar with this diagnosis, which is why I was so passionate about things. Painful periods are not normal. I want to say thank you to Dr. Billy Sakar and the surgeon and the amazing hospital staff at Atrium Health who took care of me. You guys were literally angels to me, and I am so grateful. To anyone out there who has endometriosis, I understand the depression and overall loneliness that can occur with a condition that is so painful yet so hard to be interpreted by other people outside of the body. It's hard when chronic pain is not validated and you don't get an answer or understanding. To my endo warriors, I will continue to spread more awareness around endo Matrices is so that your gemstone can be validated. You are not alone and you are so strong. Olivia Culpo, Miss Universe 2012. Causes of endometriosis. The exact cause of endometriosis is unknown, but there are several theories that explain how and why endometriosis happens. Retrograde menstruation is one popular theory of its origin, in which blood and tissue from a woman's uterus travel through the fallopian tubes into the abdominal cavity during her period. Nearly all women have some degree of retrograde menstruations, but only a few women will get endometriosis. This may be due to differences in a woman's immune system. Another theory of endometriosis origin is called colon in which cells in the body outside of the uterus can undergo changes to become cells that line the uterus. This is a common explanation for endometriosis at unusual sites like the thumb or knee. Another possible explanation for endometriosis in locations far from the uterus is that cells from the lining of the uterus travel through blood vessels or the lymphatic system, thereby reaching other distant organ or body areas. Endometriosis can also spread at the time of surgery. For example, a woman with endometriosis that undergoes a cesarean section could inadvertently have endometriosis implant in the abdominal incision so that she develops endometriosis in the scar from the surgery. Endometriosis is much more common if a close relative also had a disease. So there may also be genes that influence endometriosis. So why is endometriosis associated with pain? When a woman with endometriosis has her period, she had bleeding from both the cells and tissue inside the uterus and also from the cells and tissue outside the uterus. When blood touches this other organ inside the abdomen, it can cause inflammation and irritation, creating pain. Scar tissue can also develop from the endometriosis and contribute to the pain. But why is endometriosis associated with infertility? Between 20 and 40% of women with infertility will have endometriosis. Endometriosis slightly impairs fertility in two ways. First, by causing distortion of the fallopian tubes so that they are unable to pick up the egg after ovulations. And second, by creating inflammation that can adversely affect the function of the ovary, egg, fallopian tubes, or uterus. So what are the endometriosis symptoms? Pain is the most common symptom of endometriosis. Women with endometriosis can experience pelvic or lower abdominal pain, pain with menses, pain with intercourse, and pain during bowel movements. Symptoms can be constant or cyclical, meaning that they worsen before and during the period and then improve. Women may have constant pelvic or lower abdominal pain as well. Other symptoms include infertility, bowel, and bladder symptoms, and possibly abnormal vaginal bleeding. So how is endometriosis diagnosed? Some physicians may treat suspected endometriosis based on a woman's symptoms or physical examination findings to see if they were improved without proceeding to surgery. However, to formally diagnose endometriosis, a doctor must perform laparoscopy to visualize and biopsy suspected endometriosis lesions. Endometriosis lesions can vary in appearance. Endometrioma is the term for endometriosis within an ovary. and is often named chocolate cyst because the material inside the cyst looks like chocolate syrup. So how is endometriosis treated? The most conservative therapy for endometriosis is with medications. Non-steroidal anti-inflammatory medications like ibuprofen may help with the pain associated with endometriosis. Medications that control a woman's hormones may also help with endometriosis pain. Some examples are oral contraceptive pills and gonadotropin-releasing hormones agonists, the latter of which put women in a temporary menopause-like state. Surgery can diagnose endometriosis, and it can also treat endometriosis via removal or burning or endometriosis lesions. With surgery, removal of scar tissue can alleviate pain and relocate the ovaries and fallopian tubes to their normal position in the pelvis. Surgery has been shown to help some women with endometriosis to become pregnant. If a woman with endometriosis is no longer interested in becoming pregnant, she and her doctor may decide to remove the ovaries and possibly the uterus. A woman cannot become pregnant if she doesn't have a uterus. If a woman with endometriosis is having trouble getting pregnant, there are different medications and treatments available that can help to become pregnant. Alright, so that is all about endometriosis. So if you women experience the same thing, just consult your doctor. And now to Miss Universe 2012 Olivia Culpo, get well soon. You will be included in our prayers. And this is Tito D from the Philippines. Alright mga kabady, so this is our tip for this day. So if you want to be updated, just subscribe to my channel, hit like button, comment down below, and click the notification bell so that you will be updated once we have a new video. So that's all for now. Thank you for everyone and thank you for watching. Once again, this is Tito D on Tito D TV. Keep safe everyone. Bye-bye.